Myrna Haag, registered and licensed dietitian. Cardio gene test when standard labs are not enough for diet therapy. Your blood work can show little or no risk. In other words, you can have a perfect bill of health, yet your genes could be telling a different story. And really, this is the difference between disease care and really what healthcare should be all about. Standard labs are just a picture in time, what your body is doing chemically right now. And if those labs aren't normal, then you get a diagnosis of a certain condition, which in most cases you're treated with a pharmaceutical aid. I'm sure that that condition wasn't something that just occurred. In fact, it's been brewing for months, years, and decades before you got your condition. Our genes give indications that we are susceptible to certain diseases. But it's until we get the abnormal lab that we act on it. We are unaware that we had this brewing. In fact, in most cases, it could have been prevented, especially when we're dealing with the top killers like heart disease and cancer. In fact, most cancers, 5% are due to heredity. Genes have an indication of what foods may put you at greater risk and how adjusting your diet can reduce this risk. There are some physicians that understand this. They get it. And if your physician has recommended my services, you're in good hands. Because pharmaceuticals, they do save lives. Nobody will dispute this. But to the extent that diet can radically change the landscape of your medical condition has been proven in clinical research. I've outlined a few gene tests in regards to cardiovascular disease that can be very beneficial when designing your optimum nutrition plan. Yes, there are other gene markers I have not mentioned that your doctor may recommend, but I've listed the top tests that would be helpful as a dietitian in designing your optimum plan. Remember, your labs only give a current update. Your genes tell a whole different story. The information provided does not constitute medical advice or medical care. As always, please consult your physician for all medical concerns. Same diet, you can have very different outcomes. So when somebody says, hey, this diet works great for me, does not necessarily mean it's going to work great for you. Why? Because we're not all the same genetic footprint. Genes can affect our metabolism, our hormones, our immunity. Also, certain medical conditions and medications can affect how we metabolize fats, sugars, can affect how we're absorbing things, digesting. And also, stress and exercise has a different effect on all of us. Genotype versus phenotype. The genotype is what you have, the set of instructions. They may not get turned on. The cells may not get the message to affect the gene into a phenotype to actually create the disease or the condition that you may have been diagnosed with. The key is we don't want these genes to turn on. Prevention, and where lifestyle plays a role, is having these expressions of genes not trigger, not turn on. The World Health Organization claims more emphasis needs to be given to genetic predisposition in relations to the risk of cardiovascular disease. They go on to say that genes directly predispose people to cardiovascular disease through gene mutations. Those are when the genes get turned on, which predispose them to other diseases. And that's a real key point because it can be like a domino effect. One disease leads to the next. Not all patients respond in the same way to treatment. Genetic variations cause some patients not to respond while others respond. Next slide, we're going to talk about the top genes that really help a dietitian optimize your nutrition plan. Just want to bring home the point that cholesterol alone does not cause heart disease. It is a poor measure of risk. What causes heart disease is oxidation and inflammation. It's actually the bad cholesterols that oxidize and free radical compounds that oxidize. This triggers inflammation. Heart disease is an inflammatory disease, and diet can reduce this. Diet can reduce the effects of the bad cholesterol and also these free radical compounds that tear up our vessel walls. Now let's look and see what genes can help us better optimize your nutrition plan. These are the top 6 that can help a dietitian optimize your nutrition plan. Physicians will come up with many more biomarkers. Some will be for inflammation. You might get a calcium score. These are things that indicate your current condition. This is just about genes. These are one-time blood work that you get. It helps really look at long-term. Remember, those labs give us a current analysis, but your genes look into the future as to what we can do with your diet to help reduce your risk. I'm going to run through these in the PowerPoint real quick summary. The APO gene comes in 3 variations. We'll talk about each and how it can determine your risk factor for cardiovascular disease and some diet therapies. There's this Lp(a) genotype. This is called the widowmaker for a very good reason. We'll explain why. The 9p21 gene is called the heart attack gene. We have the LDL. Those are the bad cholesterols, and they come in particle sizes, and we'll discuss why we want to know those particle sizes. And also the HDL also comes in particle sizes. Usually when we get labs, we get the concentration. We get the amount of these good and bad fats, but the particle sizes give clue to something else, and this is a genetic variation. Also, the hepto2 genotype, this is a gene that you have that really, those that carry it have less protection against oxidative stress. Remember, we talked about oxidative stress being a huge significant factor in contributing to inflammation for cardiovascular disease. So let's move on and learn a little bit about each of these. The ApoE gene is a protein that carries fats in the brain and central nervous system. It comes in 3 variations, ApoE 2, 3, or 4. Remember, you're going to get 1 chromosome from your mom and 1 chromosome from your dad. The different protein types, the ApoE 2, they can handle a higher fat diet. The ApoE 3, they do much better on a Mediterranean diet. The APO 4, they fare better on a low fat diet. Of the ApoE genotype, the one that there's most concern with is the ApoE 4, especially if you're a 4-4. If you're a 4-4, you got both alleles from the mom and dad, you're at 9 times the risk susceptibility to Alzheimer's disease and cardiovascular disease. Remember, the APO4 is the principal cholesterol carrier in the brain. But we talked about genotype versus phenotype. Because you have a gene doesn't mean it's going to be expressed. As in the study of the Nigerian population that have high levels of the APO44. In other words, they're highly susceptible for Alzheimer's disease, yet they have the lowest incidences of Alzheimer's. And why is that? Because they consume a plant-based diet, low in cholesterol and low in fat. Remember, if the ApoE is a fat carrier, then it makes sense that our diet low in fat would reduce our risk. Now the Lp(a) gene. 1 in 5 people in the U.S. have this gene. 63 million Americans. The Lp(a) is the strongest, single most inherited risk factor for early coronary artery disease. These are the guys that have the great labs and then boom, drop over with a heart attack, just like Bob Harper. People living with the high Lpa have 2 to 4 times higher risk of early heart and blood vessel disease than normal people without this genotype. You can get some great information on this if you go to www.lipoproteinafoundation.org. I have it at the bottom of the slide. I highly recommend to get on that website. They'll give you a lot more information than the time I have to share with you now. The Lpa is attached to an ApoB LDL carrier, acts like, looks like the LDL bad cholesterol. The key with this, when you have high levels, it inhibits the breakdown of blood clots. From a dietary standpoint, no, we can't change your genes, but we can look at the food you eat to lower your risk, minimize your risk, make you less susceptible to blood clots. Widowmaker is what the Lpa gene is called. Published in January 2018 issue of the Journal of American College of Cardiology, thanks to the good work of the Lipo Foundation, there will now be ICD-10 diagnosis codes effective October 1st, 2018. This is great news because this is going to help the global population at risk for early heart attack, strokes, aortic valve disease, peripheral vascular disease, and death due to this lipoprotein A. As the cardiologists say, a genetic, sticky, fatty lipoprotein particle in the blood. They encourage diagnosis, treatment, and family screening because finding out about this reduces the fact that your first symptom could be your last. In other words, it is a widowmaker. The 9p21 gene is just another gene. In fact, 50% of the population is a carrier, either because they have one chromosome or they have both chromosomes from both parents. The key with this gene is just another risk factor. It's another biomarker that lets us know that you're more susceptible to plaque buildup. As a dietitian, this makes me realize that your diet may have to be more conservative than the guy next door who doesn't have this gene. There's also studies that show that sugar-sweetened beverages could make this chromosome G variation worse. So, yep, not big. We're not going to have big gulps every day. And also, we have found that raw vegetables and fruits can actually improve the condition. The LDL, or the bad cholesterol. Typically, when you get labs, they tell you how much of these bad cholesterol you have. But genetically, these bad cholesterol come in sizes. You either make little teeny ones or you make big ones. And if you make big LDL particles, you're at less risk than if you make small teeny ones. Concentration does matter, but you're at the greatest risk when you have a lot of concentration of small LDL particles. HDL, or your good cholesterol. What's great about that is we want those at high numbers. Typically, when we get our blood work, we look for the concentration in HDL because a lot of these good cholesterol help transport the bad cholesterol, the LDLs, away from the vessel walls. It's those small, dense little LDLs that get very sticky and help form plaque, and these good guys help remove it. The problem is particle size matters for this because larger size HDLs, they're really good functioning, good cholesterol. They can carry and handle the LDL to transport it away from vessel walls, but not the case when the HDL is small, teeny particles. So you have a genetic disposition to either make big HDL, good guy cholesterols, or small little HDL cholesterols. In this case, size really does matter. We're talking about function versus concentration. So the small HDL particles, they just have poor function in reversing the cholesterol transport. So it's important because on blood work, we're just given the concentration, but we don't know how functioning those concentrated HDLs are. Particle size helps us better know that. HDL concentration versus HDL particle sizes. How changing one letter could make a difference in understanding the role of high-density lipid protein in disease. Before 2006, most papers focused on the high-density lipid protein, HDL, contained as concentration, but now we're understanding we really need to look at the function, how well it reverses the transport of cholesterol away from the vessel walls. And what they state here is randomization analysis suggests that genetic anomalies that raise HDL concentration fail to impart the cardiovascular disease protections predicted. This is great news, folks, because this gives us more information on what our true risk is. The heptoglobin 1 and the heptoglobin 2, those are the two genotypes. Remember, you're going to get one chromosome from your mom and one chromosome from your dad. And this genotype as a dietitian is really important because if you have the hepto 1, you have more protection against oxidative stress. The margin of error in your diet is larger. But if you have the hepto 2, especially if you're diabetic, it leads to other complications. You have less protection against oxidative stress. The other problem is that it increases your vulnerability to autoimmune disease. But the good news is diet can make a difference. Clinical studies have shown that with the hepto 2 genotype, we can actually lower your susceptibility to autoimmune diseases and lower your susceptibility to oxidative stress, especially if you're diabetic, by just changing your diet. Bringing some clinical evidence, I know a lot of people have never even heard about the hepto 2 genotype, but the hepto 2 genotype is really important, especially if you're diabetic, because you're going to be more vulnerable, especially for renal disease. Simple diet applications can make a difference. Number one, the antioxidant vitamin E can help with these people. And also the dysfunction that this brings as far as the gut bacteria, which we talked about, it actually changes the tight junctions in the gut and actually can open them up, make it more permeable, which they believe increases your disposition for inflammatory bowel disease and autoimmune diseases. Another factor with the heptoglobin 2, as if that wasn't enough, is that there is a correlation between the gut microbiota and psychiatric disorders. There's enough clinical evidence that's now surfacing that it does affect, they call it the gut-brain axis. So this Hepto2 can make you more vulnerable to this gut microbiota disturbances, these imbalances, which can actually even affect your moods. So this study talks a little further about the role of the heptoglobin gene and its related association with the protein zonulin, which they have found has been a precursor to inflammatory bowel, to lupus, to rheumatoid arthritis, these autoimmune conditions. And the heptoglobin 2 gene, you understand from a dietitian, that would be very important because it's something that really can be controlled through diet. Zonulin for these people is a bacteria that is from eating wheat or gluten. So something as simple as removing gluten from your diet has shown to actually decrease the risk for the autoimmune or any kind of gut permeability that contributes to these diseases. In vitamin E, something as simple as vitamin E can have a benefit for these heptoglobin 2 genotypes. And some of the clinical evidence has shown, especially those that have diabetes. So I'm not an advocate of excess vitamin supplementation because in my vitamin videos, you'll see that vitamins are things you keep in synergy. You don't megadose. They compete for receptor sites, and there's clinical evidence that shows excess of anything isn't really good. It's all about balance. But in this case, they've shown that vitamin E has been effective on kidney structure and function in mice with this 2 genotype, especially those with diabetes. Okay, this is probably overkill, but it's a genotype people are not familiar with. And once again, let's just summarize. The 1-1, they have more oxidative stress protection, and the 2-2, they get a gut bacteria that has been associated with autoimmune disease. They have less protection from oxidative stress, which I told you is the main contributor for inflammation for cardiovascular disease, and it puts the diabetics at higher risk. So the KIF6 is a gene that really did make my top 6, but I know a lot of physicians do recommend this genotype. And it's really probably a good one to have because it does make you, it tells me as a dietitian that you're a little more vulnerable to the LDL cholesterol, but a lot of those other genotypes are going to give me a pretty good indication. But with this genotype, if you do have the others, it's good to get this one tested, especially if you've been given a statin, because studies support that 40% of the gene carriers will not benefit from a statin with this genotype. That's right, only 60% of the people that have this genotype will have any benefit from a statin. But physicians don't just prescribe statins because of their cholesterol lowering ability. It's also because they're good anti-inflammatories. And this is something only your doctor can recommend. But it is something to know that there is a genotype that you can get that tells us a little more about your vulnerability to LDL cholesterol and your reaction to statin. Once again, in summary, these are the top 6. From a registered dietitian standpoint, they can help create the most optimum dietary plan. Understanding what your risk is helps dietitians better understand how to design a plan that will reduce your risk. Registered dietitians specifically trained in clinical nutrition help design a nutrition strategy that takes into consideration current labs, medical conditions, lifestyles, and genes. It's about prioritizing the healing process.